Hey everyone, I'm Lucy Douglas. I'm a family nurse practitioner and I'm owner and CEO here at New Beginnings Wellness Center and Spa in Ruston, Louisiana. I started talking to you last time about our aesthetic products, and I want to introduce to you the products that I've chosen to use here at New Beginnings for the aesthetic practice that I have. So we're going to talk about dermal fillers and we're going to talk about neurotoxin. And so last time I kind of introduced the topic and talked about my background in injecting, and I mentioned the first portfolio of fillers that I use here at New Beginnings, and those are the Allergan fillers. And those probably have the greatest name recognition in our part of the state. And certainly injectors get comfortable with various products. Generally, for me, it was the products that I had in my initial training back in 2012. And so this is a really great line of products. It meets a lot of patient needs. And so I just want to kind of show you each one of these and just talk a little bit about them. As a patient, as a potential injecting client, you probably don't think a whole lot about, well, why would they be using one gel versus another on me? And some patients are real interested in that and they ask those questions. Others are just like, how much does it cost? And that's pretty much all they're interested in. So that's fine too. But I do want you to know that for the injector, it's something that we're analyzing the minute you walk in the door. And if we do carry a broad portfolio, which I do, then we're thinking to ourselves, what are their needs? What is their budget? How can I best meet their need and put together a plan that's not only affordable, that's going to give them the outcome that they want? So to start off, let's talk about, hang on, there we go. So Juvederm, this is Juvederm Ultra. So some of the terms that we as injectors are familiar with, we're thinking about, first of all of these are hyaluronic acid, which is something that we all have in our body, but these have been genetically manufactured in a lab and they have, obviously their shape has been altered, the molecule, so that your body doesn't just immediately turn them over to water and they're gone. So when I use Ultra, this might be on someone I would choose to do a lip. And maybe this is a young person who is able to rock a pretty voluptuous look, and they're really wanting that. So I might choose Ultra because it is a little bit of a water-loving filler in that the molecules of hyaluronic acid in this product might draw in extra water, thus creating a little more plump and volume. So you could kind of see why that might be a great filler option for someone younger who maybe has naturally a pretty shape already, and I'm not having to kind of build a lip, and that they are really kind of wanting that plumper, more beautiful, lush look, and they feel really comfortable with that. So I might choose to go with Ultra. You can expect efficacy on Ultra. Most people you could expect about 9 to 12 months. I've had a couple of weirdos whose metabolism churned this up in 3 to 6 months. So that's just not something as an injector we can guarantee when you're getting fillers for the first time. But that is what the manufacturer tells us, that we can expect a 9 to 12 month efficacy on Juvederm Ultra. So great product, gives us a really great lip, and I have used this a lot and been really pleased with it. So we move on to Juvederm Ultra Plus. So it's a little bit of a cousin to the Juvederm Ultra. So there's another term in those of us who do injecting. G prime is a term that we're all familiar with. There's characteristics of all these fillers, and that's called their rheology. So some of these are going to be firmer, more elastic. Some of them are going to be smoother. The little shapes of the hyaluronic acid molecules will be formed in such a way that they're more smooth. So there's all of these things we're thinking about when we're looking at you and putting together your individualized plan. Where does your filler need to go? How long are we hoping that it will last? What's your budget? So many things to consider. Ultra Plus is a firmer filler over Ultra. It actually can be used in the lip, but it can do well in a chin to build a little strength and volume in a chin. It could do well. This is what we used to use before a new product I'm going to talk to you about. It's been out. It's not new, but it's newer. We used to use this even for cheek and chin, where now we have Juvederm Voluma, that is a really great option for cheeks and chin. So we can actually build some structure beneath the skin. We can place this on the bone and actually build almost like tent poles to hold up the skin, and then maybe use a softer product a little more superficially just for some softening and moisturizing in the more superficial tissues. So Ultra Plus and Voluma. Voluma is going to have a higher G prime. It's a more firm product than the Ultra Plus. So we're starting out like retail pricing with Ultra and Ultra Plus $600. We're jumping to $800 a syringe on the Voluma, but the efficacy for Voluma is about 2 years. So if someone invests, in a couple of syringes of Voluma, they're going to get a good efficacy with that. So if we're going to use that to build cheeks or chin, that's going to last a while. Most patients are pleased about that. So then we have Velour, Juvederm Velour. So this is a softer product than Voluma, though they were introduced around the same time. So they're the new Allergan Vicross technology. So they did something to these products with the hyaluronic acid in the lab called cross-linking. So that's the aspect of this HA filler that makes them have a longer efficacy. The Velour, though, is indicated for like fine lines in the nasolabial folds, places like that where we don't need something as firm. So this is also lovely in the lip. That would be considered an off-label use of Velour, but it is beautiful. It's very soft. It doesn't have that water-loving aspect that the Ultra. So I'm going to probably gravitate more towards Velour for the more mature lip. Maybe a thinner lip where I'm going to really have to take my time and be patient to build some structure and volume, but it is lovely. And I've had Velour in my lips and I really liked it. Another product that I've used in the Juvederm portfolio is Juvederm Vabella. This is a really great product. This is probably the softest of all of them. This was indicated initially for the perioral lines. Those in women that have that, it's really a bother to them. And those are tricky to treat. And you need something very, very soft. And it's almost like you're placing it more superficially as almost like a hydrator, because that's what hyaluronic acid is. Those molecules, there are hyaluronic acid skincare products out there, and that's how they're marketed, to draw water and to moisturize. So that's almost how we can place that in those perioral lines, or even in a more mature woman. I've used that in some of my 70 and above year old clients who are just needing some definition back, some softening of the perioral lines, and just giving them a slight hint of volume. I always tell patients, I don't want your lips to enter the room before you do. So my aesthetic for myself is very natural. I've said to you before, I want to keep having my birthdays, but I don't necessarily want to wear all of them on my face. So these products can help us attain longevity in our facial beauty, and they can be used very strategically to correct volume loss. One of the things of aging that we don't talk a lot about, we talk a ton about volume, but we don't talk about the bone loss in the face associated with aging. So the Voluma, being able to place that down on the periosteum, helps us to sort of compensate for bone loss, which then goes on to create havoc with perhaps hastening the formation of jowls, or those deep lines here. We call those marionette lines. Or in women that are naturally lean, that can be a double-edged sword. We're always telling everyone to maintain a healthy weight, but as we get older, that can be difficult because we can't tell our bodies where to lose the weight. So it seems that women are like, I'm losing weight in my face. So we want to come at the aging process all different ways. And so we can use these products, the ones that are appropriate to be placed on bone, to even stimulate a little bit of bone production, to restore some of that structure. And then we work on the tablecloth, if you will, or that skin, that outer part that we wear all the time. And then we've talked before about the importance of skincare. So that's something I'm always going to talk to an injecting client about is, we're going to come at this 360 degrees and we're going to talk about skincare. So I hope this is interesting to you, just knowing there's a lot that your injector is thinking about when they're choosing a product for you. And this is just introducing you to the one portfolio of products that I offer here at New Beginnings. So stay tuned. We're going to talk about some others too. Thanks, and I'll talk to you soon.